Hello, I'm BJ McCollum. I'm one of the physicians here at Medina Health System. I want to talk about men's health, specifically screenings, risk factors for disease, and ways that we can be healthier in our community. Research has shown that men do not come to the doctor as much as women, and men are less likely to have a primary care physician compared to women. Let's go ahead and get started on the agenda. We're going to be talking about cardiovascular health screenings, age-appropriate cancer screenings, hormonal and testosterone management, and then when to perform self-exams, what we're looking for, and then when to seek medical help. So the importance of cardiovascular screenings. Cardiovascular death still ranks as the #1 cause of death in the United States. It is very preventable, and actually a third of all deaths are preventable. And we're going to go through ways that we can prevent that and identify risk factors: smoking, elevated blood pressure, sedentary lifestyle, obesity, high blood pressure, diabetes. All are risk factors for cardiovascular death. So specifically death from MI, so that's myocardial infarction, heart attack, or stroke. So ways that we can identify these factors early is to have regular checkups. So if you're a man over the age of 40 and you haven't been to the physician in a while, you need to come in, you need to get a blood pressure check on you, talk to you about your cholesterol, and screen you for diabetes. Let's talk about blood pressure screening and what elevated blood pressure is. So elevated blood pressure is defined as having two separate readings of greater than 140/90. If you have a blood pressure that is elevated on two separate occasions, then we'll talk about management for that. I want to specifically talk also about the Preventive online calculator. So this is the most recent calculator that we use when we're calculating your 10 and 30-year risk of having a cardiovascular event. Previously, Framingham risk assessment was used. There was a different calculation used that came out in 2013. And then today we use the Preventive online calculator. So that's using factors such as age, gender, presence of diabetes or hypertension, chronic kidney disease, in our calculation of your risk for having an event within the next 10 years. The other thing is BMI, and so specifically having a waist circumference greater than 40 centimeters, having a BMI greater than 35, and so that's body mass index. That's a calculation that we use using your height in centimeters over your kilogram squared. People who have a BMI greater than 35 or a waist circumference greater than 40 inches have an increased risk of diabetes and increased risk of having cardiovascular disease. The other thing that we want to talk about is diabetes. 1 in 8 men have diabetes in South Texas. This is considerably higher than the average in the United States. Diabetes is defined as having an A1C of greater than 6.5 or a fasting blood sugar of 126. You can calculate your 10-year risk of having a cardiovascular event. We're talking about cholesterol, dyslipidemia. Men over 35 or men between the 20 and 34-year age range with risk factors need to be screened every 1 to 2 years with a lipid screen. Sometimes even if you don't have risk factors for it, some people have heritable factors that cause your cholesterol to go up. We'd like to look at that for you and then determine if you should be on medicine or not. That is a risk for cardiovascular death. Abdominal aortic aneurysm. 10% of men over the age of 65 are going to have a AAA. We call that abdominal aortic aneurysm. And what that basically is kind of like a balloon. So your aorta will start to dilate and become thin. And that's secondary to disease over time. If you're a man over the age of 65 and you have smoked, even if you've smoked a pack a day in your life, you need to have this one-time ultrasound to screen you for this condition. The mortality for this is extremely high, especially if that aorta bursts. The results of that can be very devastating. So if you're between the age of 65 and 75 and you're a man and you have smoked in your lifetime, you need to have abdominal aortic ultrasound to screen for that condition. Inactivity is a factor that affects men. Interesting enough, about half of all men over the age of 18 do not engage regularly in physical activity. And what is that defined as? That's defined as having 150 minutes of moderate intensity exercise or 75 minutes of vigorous intense exercise, and we'll talk about what that means. So as I talked before, a third of all cardiovascular deaths are preventable, and the ways that we can prevent them is improving our diet and improving our exercise. So the DASH diet and the Mediterranean diet have both been shown in clinical studies to reduce rates of cardiovascular deaths. So I put a diagram up here of what that means with the DASH diet. That means having over 4.5 cups of fruits and vegetables a day, increasing your intake of lean meats, particularly fish, and reducing your sodium intake. The other factor that I want to talk about is smoking. Smoking is definitely a preventable risk for cardiovascular death. Smoking damages the inner lining of the blood vessels, makes them more susceptible for development of plaque formation, and is associated with both coronary artery disease, those are the blood vessels that surround your heart, as well as aneurysmal disease involving the rest of your vasculature. If you can stop smoking, it decreases your risk of having 12 different cancers, particularly cancers that affect men would be bladder cancer, colon cancer associated with smoking, as well as lung cancer. And lung cancer in of itself is the cancer with the highest rate of death of men in the United States. We can reduce our risk of having cardiovascular death by improving our diets, exercising, and stopping smoking. So let's talk about what exercise, how that can improve and reduce our risk of having cardiovascular deaths. So the studies have shown is that having regularly incorporated exercise can reduce your risk of having a cardiovascular death by about 15 to 39 percentile, and stroke by 33%. What that defines is, so the U.S. Department of Health and Human Services defines exercise as 150 minutes of moderate intense exercise or 75 minutes of vigorous exercise. These kind of stem from these guidelines published in 2008. Studies have shown, interesting enough, that any form of exercise, even if you're doing half of what the guidelines show, you still have a risk reduction in cardiovascular disease. What is defined as moderate versus vigorous? Mild would be walking less than 3 miles an hour. Okay? Moderate would be bicycling less than 10 miles an hour. Vigorous bicycling would be greater than 10 miles an hour. And so if you've ever rode a bike, it's very easy to get over 10 miles an hour. And if all you're doing is doing 75 minutes, you've hit your target for the week. You go for an hour bike ride per week, add another 15 minutes in, and you've hit your goal, your threshold for that week. Finding the type of exercise, you just got to be very creative in what you're doing. I mean, I've listed golf as a mild intensity exercise. If you walk and you play 18 holes of golf, that takes you 4 hours less if you're very good. So exercise opportunities in Hondo. So I've listed several opportunities. So I work out at the Rock Fitness Center. I've posted a photo here. We see all the wonderful people there at the gym that day. And oftentimes it's kind of sad. I'm often the only one there, and so I feel like we need, as a community here in Hondo, we need to be filling our gyms more. I've included Anytime Fitness on Highway 90, the golf course. So I went and I ran at the golf course, and that's an easy way to get minutes in toward your target for the week. And if you're not running, you can play golf, you can walk. Let's talk a little bit about prostate cancer. Prostate cancer is the most common non-skin cancer in men. And interesting enough, the death rate is not high, but the complications related to that, development of metastatic disease, can be very debilitating. Traditionally, really since the 1990s, we started using the PSA, that's the prostate-specific antigen, to screen. During the 2010s, the screening for that decreased in America because different societies recommended not using the PSA to screen for prostate cancer, and so consequently the rates of metastatic disease, metastatic prostate cancer, went up. So now the recommendation is to have, it's a shared decision, it's a shared conversation that you're going to have with your provider or physician, and the American Urological Association recommends getting the PSA check every 2 years, starting at the age of 50 and going up to the age of 69. And so you may ask, why was that controversial? Well, they were showing that the death rate from prostate cancer didn't really change much when we were using PSA regularly to screen, but the risk of having complications related to false positives or having biopsy-related complication increased when we were screening for that more regularly. However, if we can screen, we can reduce the risk of metastatic disease. For any of you who have metastatic prostate cancer, that is not fun, especially if you were taking Lupron. I personally recommend that we go ahead and be aggressive about that. We screen for the PSA. If you do have elevated risk factors for prostate cancer, so of having a first-degree relative or being of Black ancestry, we need to screen for that earlier. We would talk about screening at 45 or screening 10 years prior to when your first-degree relative develops that condition. All right, so let's talk a little bit more about understanding testosterone decrease and how we can improve that. So after the age of 40, testosterone is going to go down with time. That's part of physiology. That's the way we were made. When those testosterone levels go down, our mood is affected by that. Our energy level, it affects sexual function and overall quality of life. How can we improve that? Well, interesting enough, if we are exercising, running, lifting weights, playing pickleball, riding a bike, we can increase our testosterone. The more fat that we can burn off and the higher percentage of lean body mass that you have, that's going to improve the rates of our testosterone in our bodies. And then getting adequate sleep. Most of us have full-time jobs, we are working, or have families, and so to sleep 7 to 9 hours a night is very challenging, but if we're disciplined to exercise, to eat appropriately, and to get to bed at a decent time, and to cut down on our alcohol use, we can improve our testosterone levels. All right, so let's talk about how we diagnose that. And so if you're feeling weak, tired, definitely lower energy at the end of the days, having mood swings, feeling like you are very sleepy, we'd like to have you come in. We can kind of tease out different conditions that can also cause that. If we want to get a diagnosis of secondary hypogonadism, we really need to get your testosterone levels. If we get 2 under the level of 300 on 2 separate occasions, preferably in the morning at a fasting level, and we can prove that, we can talk to you about replacement therapy. Who cannot be on testosterone replacement therapy? Well, if you're still considering having more children, I'd highly advise not going through with that. It can affect your fertility. Once you're completed with child rearing, then we can talk about replacement. If you have a PSA greater than 4, you need to undergo surveillance. We need to repeat that in the next few months, or we need to talk to a urologist. What I would not want to do is give you testosterone and then your PSA jumps up, because it could bloom or increase undiagnosed prostate cancer. And so that's the last thing that we want to do. Interesting enough, being on testosterone therapy increased your risk of having cardiovascular disease. Original studies showed that they did, but there was a recent trial that showed that there was no increased risk of MI or stroke with testosterone therapy. However, if you have had an MI, if you have had a heart attack, if you've had a stroke within the last 6 months, then we do not need to start that on. Other contraindications, if you have severe prostate problems, so an enlarged prostate, or if you have uncontrolled heart failure or COPD. And so if you're a good candidate to be on testosterone therapy, and we can talk about that in the office, then the goal of care is to maintain your testosterone between 300 and 900. And we would check that every 3 to 6 months to begin with. We'd also check your PSA annually to make sure that that's not bumping up, and then checking hematocrit, because once you start testosterone therapy, it can cause your hemoglobin and hematocrit to increase. That's your blood cells. And if it gets above 48%, we advise not starting the testosterone. If it gets above 54%, then we need to talk about taking some blood off, because that is a risk factor for a stroke. Let's talk about performing self-examinations. So, interesting enough, men are less likely to come into the doctor for complaints. They're less likely to have a PCP. If you're noticing some changes in pigmentation on your face of a mole, or if you're noticing a rough spot on your arm, we need to check that out. And testicular cancer affects men. So if you're noticing some swelling in your scrotum, you're not sure what that is, we'd like to see it. That's not a standard exam component that we perform in the office without a particular complaint. So if you're concerned about it, we're concerned about it, and we would be happy to look at it for you. Prevention is key, so recognizing signs and symptoms. If you're having chest pains, if your blood pressures are going up, if you're concerned about a mole or a mass, we would like to see you and take care of that. Timely interventions and treatments are key to your health and to improving your longevity in life. In conclusion, if you're over 40, we need to have you come in, at least get a blood pressure check with us, allow us to get a cholesterol and diabetes screen for you. Let's talk to you about your 10 and 30-year risk of having a cardiovascular event, which in layman's terms, that's a heart attack or stroke. And then if you're over 45, we need you to come in, get a colonoscopy, or talk to us about a colonoscopy. And then if you're feeling tired, fatigued, we'd like for you to come in, get labs done, and we can talk to you about testosterone management.